Good afternoon, everyone. I hope everyone is well and everybody is enjoying the day. Thank you for coming along today. My name's Kimberly. I'm the East Region Physical Activity Social Prescribing Lead, and we're going to have a little chat through how social prescribing physical activity is a marriage made in heaven and how we can really start to embed getting people moving more to manage their health. We have a slight little technical issue this afternoon rather. We don't have a Q&A function, so if you do have any questions today, then please do email Sian at sian.brand2@nhs.net, and then hopefully we will be able to answer a few of those questions later on as we move through the presentation, and some little Q&A at the end. So why am I here? Why are we talking about physical activity and how does it all fit together? So I'm one of 7 regional leads funded by Sport England to work across England to embed physical activity into social prescribing. It's a really new area of work. I've spent the last 6, 7, 8 months trying to figure out how it all fits together, and how we can all start to work good together. So basically looking at it all in practice. So I split my time between a regional role across the East and also in Essex as well. I work as part of a wider cross section of individuals. So we have a regional core group led by NHS England improvement team. Alongside that, we've got the National Academy for Social Prescribing. We've got the Arts Council, us here with Sport England, Nature with Natural England. We've got Money and Pension Service with Money Smart. And also we've got Public Health England and obviously NHS England as well. There's a lot of resource and energy going into social prescribing at the moment. It's a big thing for NHS England, and also for the community as well. So social prescribing is nothing new, but it's really started to cement it in what we do and how we work, and obviously within the health sector as too. A key part of my role is to ensure that we connect all of these organisations and yourselves together and really get physical activity and moving more into what we're doing. So working on a national, regional and local level to get both sides of the picture, basically what you guys are seeing on the ground, also what we're working on, and on that bigger national level as well. So why are we so bothered about physical activity? So physical activity is stated by the Chief Medical Officer. If physical activity was a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat. So the guidelines state that for good physical activity and mental health, adults should aim to be physically active every day. Now, what that activity level looks like for each individual will be rapidly different. So any activity is better than none, and more is still better still. So beyond prevention, there's really good evidence to demonstrate that the regular physical activity can benefit patients with a number of diseases. As we go through all the slides today, it's really important that whilst we might reference physical activity, we also just mean moving more as well. So the benefit for people is huge, and that's why I will sit here and champion all about it. So physical activity, as we've spoken about, doesn't just mean going to the gym. It doesn't mean getting in Lycra, having to have all the fancy kit, you know, go and parade around or anything like that. What we're talking about is moving more in as many different ways as we can. So whether that is structured exercise, joining a club, joining a community group, you know, there's reference to so many different things. It can also be chair-based exercise. We could be just getting individuals in their own homes to move their arms and move their legs when the ad breaks on during Corrie, for example. So physical activity is on lots of different levels. So active travel is one that we're really starting to have a look at the moment, around how we can get people out of their cars, off the streets, and using their feet, using bikes to get about too. We've also got things like active recreation. I don't know about you guys, but over the last 20 months, I've probably walked more than I have in the previous kind of 3 or 4 years leading up to that. We were all out and about. We were all trying to get some kind of exercise or just break up the norm. So what we're trying to do is look at just encouraging people to keep going with that too. So regular physical activity provides us with a range of physical and mental health benefits, but there's also social benefits too as well. So different ways of increasing people's self-confidence, about how they interact with their community within social settings, all of these different things about mental function as well, hand-eye coordination. It doesn't just have to be about pounding the streets and going out for a run. So being more active can help manage long-term conditions. It can help manage existing and reducing anything additional as well, ensuring good musculoskeletal health, which is so important as we start to age as well. So we've talked about physical and mental function and independence. The more we can keep people active, the more we can keep them in their own homes for longer, out doing their own thing, without the necessary assistance from social care, for example, but also supporting social inclusion, so that, you know, keeping people in their communities, out and about, having conversations, having a cup of tea, having something to do. Physical activity and moving more can play that part as well. And also, one of the biggest things, reducing inequalities for people with long-term health conditions as well. Talk a lot about health inequalities and what we can do to try to manage that as well. What are the benefits of physical activity? Not just with the obvious, but we've talked about it very slightly here already. It can reduce mortality rate by 30%. It can reduce cardiovascular disease by 35%. It can reduce type 2 diabetes by 40%. Then we've got the effect of being more active can have on cancers too. The effect it can have on helping to reduce the level of depression within our society, within our communities. We talked about health and strength of balance work by being more physically active. If we're more active, we are less likely to see hip fractures by 68%. And again, looking at those cognitive functions around dementia, 30% reduction at the risk of developing dementia by being more active. So 1 in 3 of men and 1 in 2 of women are not physically active enough to maintain good health. So men are more likely to report that they're being more active at the recommended level than women. But physical activity, as we know, will vary with age, life stage, our circumstances, and also our physical and mental capabilities as well. So people with disabilities, long-term conditions, are twice as likely not to be active enough to maintain good health. It's well known that if you have a long-term condition, being more active will help you manage your condition more effectively, stop progressive, any ongoing progression, and anything else occurring as well. So you risk you developing anything further. So what are the guidelines? What is good physical activity for good health? Doing some physical activity is good and every minute counts, so it's never ever too late to start. We collect a lot of case studies around people who are becoming more active later in life. I know of a 91-year-old who goes to a weekly Zumba class and wouldn't miss it for the world because she sees the added benefits of being more active. So whilst we're talking about physical activity, it's again really important to remember just moving more, using your own body weight as resistance is just as good as going and slogging your guts out in the gym for an hour. So using your own body, what does that mean? So we're talking about getting people to stand out of their chairs. We're getting people to walk up and down the stairs. We're talking about reaching out of cupboards, lifting, basic things like shopping. So there are 3 elements of physical activity guidelines. So we're talking about strength, cardiovascular, and reducing the amount of time that we sit down. So sedentary time. The added benefit of balance and flexibility for older adults, we've already spoken about, and a combination of the different levels of activity as well. So moderate, vigorous, and very vigorous intensity of exercise. And that will vary depending on who we're talking to, who's carrying out that. So adults should aim to minimize the amount of time spent sitting or lying as much as possible, breaking up long periods of inactivity with at least some kind of movement. And that might be, as we spoke about earlier, being more active during the ad breaks when your soaps are on. That could be marching with your feet whilst you're sat in your chair, doing some arm moves and circles, just getting more moving more often. There's government guidelines about how much we should be doing and on what level. So this is what it looks like on a weekly basis. Okay, so we're aiming for the average adult to be at least 150 minutes of moderate exercise. And that's, when we talk about moderate exercise, we're talking about our exertion level. So they should be able to talk, but maybe just be a little bit breathy. Okay, or 75 minutes of exercise of which is a vigorous intensity. So that is, our breathing has increased and we've got a little bit more difficulty in talking. Now, that might be that you're in the allotment turning over your veg patch. That might be that you've gone out for a run. That might be that you've run up and down the stairs. It could be anything for anyone. And we've talked about improving balance as well. So a couple of times a week, looking at improving our balance, excuse me, with things like bowls, tai chi, dance, all of these things where our proprioception of space is challenged. It could be just having a dance around in your kitchen. Doesn't mean going to a class necessarily. So this is what we've got for a wider audience. So women after childbirth as well, encouraging them to get out and about and keeping moving. You're looking at being as active as possible. And then we've got our guidelines for disability adults as well. So that talks around making it a good daily habit. So it really must stress that there is so much that physical activity and moving more can add to people's lives, regardless of their medical conditions, their disabilities, or their social state. So it's about finding what's right, what works, and is at the right level for that individual. So why are we bothered? Why am I sat here talking to you guys about being more active and encouraging your clients to be more active? In the United Kingdom, physical activity is the 4th greatest cause of ill health, with impacts negatively on health, social and economic outcomes for individuals and our communities. Being inactive is responsible for 1 in 6 UK deaths, which is the same level as smoking. Okay, just to put that into context for you. 40% of long-term health conditions can be prevented if everybody was to meet the recommended guidelines that we've just looked at. The cost to the UK is around 7.4 billion annually, and the cost to the NHS services for inactivity has just this year gone over £1 billion. So these are preventable cases, preventable illnesses, all caused by not moving enough, okay, and not being as active as we should. As a species, as individuals, we are designed to move, we are designed to be on our feet as much as we can be, and we are designed to use our own bodies in resistance. So what makes us healthy? So let's start with the 10%. As little as 10% of the population's health and well-being is linked to their access of healthcare. So we need to look at the bigger picture. So this is where you guys come in. So we're looking at surroundings, money and resources, housing, education, food, transport, and the community in which we sit in. Okay, the picture isn't the same for everyone, but this is a kind of a generalized look at how it works. Our lifestyles and the community around us and our personal situation are said to affect 90% of our health and well-being. So we're trying to look at people as a whole, trying to look at people with that personalised approach, which you guys are all about. And we're looking to see what we can do to support them within their communities, keep them well, keep them mobile, and keep them active as much as possible. So we know that people are not just going to become more active just because we're going to tell them to do that. We know we need people to get ready for a change. So how do we get individuals to realise the benefits of physical and mental health through increased activities without telling them to become more active, to live healthier lives and understand the importance of moving more? We need you guys to help us in that. So we're looking at those supporting the wider determinants of health and incorporating daily physical activity. So it's not necessarily about telling everybody to go and join the gym. It's about trying to get people to move a little bit more, sit a little bit less, and start to reap some of those benefits as we move on. So long-term health conditions, I noticed something that quite a few of you came back to us and said we're not quite sure how we support people with physical long-term conditions. So this is what we can have a quick little look at now. 1 in 3 adults in England live with a long-term health condition. They are twice as likely to be among the least physically active within England. So the evidence shows us that, and we know that regular physical activity can help prevent, manage and slow the development of any additional illnesses. But how do we get to them? How do we encourage them? How do we get to speak to those people with long-term health conditions about the benefits of being more active? So it's being described as the best drug out there, you know. So how do we do that? Physical activity can benefit those with MECC conditions. It can benefit people who are coming out of cardiac or cancer rehab, and it will help manage the medication rates and all of these different bits and pieces. So considerations when you are talking to somebody about being more active, or thinking about prescribing or signposting them to a different club, group, session. Talk to them about starting slowly and building it up. It's really, really important that they listen to their own body. They make the most of the good days. People with long-term health conditions have good days and bad days. Okay, and it's just about what we do when we're feeling good to help us maintain that good level for longer. quite really hard. They might be really up for it. They might be really super excited, and they might kind of go in with it big time and want to run before they can walk. Try really to guide them through being steady, slow, and maintaining. Okay, we don't want to go all out for 3 weeks. You know, I've gone swimming every other day and then nothing for 9 months after that. It's about just building that habit, making it part of their lives and making it sustainable throughout. Really important with a lot of long-term health conditions due to their medication. Hydration is really important, so making sure that they are hydrated before, during and after whatever it is that they decide to take up, if it's a bit more structured. And their medication, that they take it, they have it with them if they need it, and they understand any potential side effects that they might need to watch out for, particularly around anybody who's on a beta blocker for reducing blood pressure or reducing heart rate, that kind of thing. Just need to be wary of what they are doing. And watch the joints, watch the balance. A lot of people with long-term health conditions have quite bad spatial awareness. A lot of them, because they've spent so long sat down, they have issues with their balance as well, and the joints have been quite badly affected with various different conditions. So it's about taking it slowly, taking it steadily, and perhaps starting at home before they look to try and do anything else out in the community. The key thing to remember is anything you did today is more than you did yesterday. And that's really important to remember. Little, often, and a gradual build up. So making every contact count, okay, something you've probably heard of, something you've probably experienced. I know certainly myself and Sean have had conversations around what we can do to support it from a physical activity point of view, but also just encouraging people to move more. So making every contact count is about altering how we're reacting with people. You know, how we can get them to recognise, how we can recognise opportunities to talk to them about their general well-being, their general health, in a open environment where clients feel comfortable, safe and confident to have those conversations about their lifestyle, basically. Excuse me. And anything that we can help signpost residents to other services, and working with other groups too. So having a good making every contact count conversation is about supporting opportunities to talk to people about their well-being. So when you're having those phone conversations and hopefully more face-to-face conversations, what can we do and how can we style that the tone, the openness of a conversation to have more opportunity to talk to them about their general well-being? For a lot of people, we know being more active is going to be at the bottom of the kind of importance level because they've got so many other things going on. But when they are ready and able to have that conversation, it's really important that we enhance it and work with it in order to build confidence for them to start it. So we're asking you guys to really think about how we can motivate a person to take action to improve their well-being. Small steps, we've just talked about it, small, steady, and on a regular basis. We want people to take actions for themselves. We want people to take ownership of their own well-being and their own health. But we would definitely be there to signpost them when they're ready and where they want to be. There's a brilliant resource out there called Moving Medicine. I'm going to have a brief little look at it now with some bits and pieces, but it's really worth your while having a more in-depth look at it if you haven't already. It's an initiative led by the Faculty of Sport and Exercise, and in partnership with Public Health England and us here at Sport England. It's a digital toolkit for clinicians, allied health professionals and people like yourselves as part of a Moving Healthcare Professionals programme. It's been developed in collaboration with experts, professional bodies, charities, as I say, Public Health, NHS England. All of these different people have come together to talk about how we can get the health sector and those that are involved in it and are working within it more active. So a couple of things for you to have a little look at here. So we're going to look at a 2 to 3 minute conversation that you could potentially have with somebody who is type 2 diabetic. So open questions, non-judgmental language, delivering it in a really respectful manner keeps an individual interested in what you have to say. It's about planting the seeds for change. You're not going to change someone there and then. You're not going to suddenly get them to go get on their bike and do a 5-mile loop round Basildon, for example. We're talking about just feeding in little nuggets about being more active, moving more, and talk to them about the benefits of what they'll start to see if they do that. So really good open questions, as we can see. Would it be okay? Would it be okay to talk to you about, you know, some things that I've seen with other patients with your conditions that I think you might find helpful? It's open, it's light, it's not coming at anybody being, to say, judgmental. So what might that then look like? So your answer and response, if they say yes, they're allowing you to now give them some information. So many people with type 2 find that moving more helps them manage their conditions and their symptoms. I wonder what you would think of that. Is that something that you could do? So how you ask the question allows the client to have some space to think and explore the information that you're giving to them, instead of you just spouting out, you must do this, you must do that, you must do this. It gives them an opportunity to think, well, okay, well, that's someone like me. I could do that too, perhaps. So if appropriate and the time allowed, we all know that everybody's really time precious when we're talking to clients, when we're talking to patients, when we're in clinics, etc. You've got an opportunity to drop in a couple of little sentences to improve and empower people to feel that they are in control of their own health. Okay, so these are some really good key things you could come back with from that conversation. It improves blood cholesterol, it improves blood pressure. Okay, these are all things you can come back to them. It reduces your medication. Someone with type 2 diabetes, that, you know, if they are just on tablets at the moment, there's a great opportunity there for somebody to start actively getting more mobile and doing more activity to help reduce the amount of tablets and reduce the need to potentially go on to other forms of management like insulin. Okay, so these are, again, all of those little things that we've spoken about already that you can start to put into conversations. When you've got an opportunity a little bit longer, perhaps, you could say something along the lines of, would you be interested in talking a little bit more about how to be more physically active? You know, whether that's with yourself or whether that's with you signposting to somebody else, the health and wellbeing coaches, the physio. You know, it might be that they need to see the physio to talk through an issue because they've got musculoskeletal damage, you know, so that might make them feel safer. So not necessarily for you to give out all the information, but if they're willing, you could then do to signpost them to another service to kind of capitalize on that opportunity. If you're signposting somebody on, you could say something along the lines of, in the meantime, whilst they're, you know, we're waiting for them to get in contact with you, could I give you some information to read that would be of interest? Okay, there is lots and lots and lots of information that's available on the Moving Medicine website around takeaway information you could give out to clients. There is some fantastic stuff on the We Are Undefeatable website, which I will leave you all the links for today, so you can go and have a little explore. And it's just talking, as we have done, about moving more, doing the little things, and how it can help benefit conditions. There are lots of opportunities around having longer conversations with individuals when you've got a bit more time. Would you be, asking those questions? Would you be happy to spend another 3 or 4 minutes talking about something that I think can make a really big difference to your future health and well-being? If they say no, they say no. If they say, yeah, okay, I'm a little bit interested about what you've got to say, gives you that opportunity to start that conversation. And it's really important that we're talking about it in a personalised manner. We're all about personalised care, patient-centred care. So it's really important that we're talking about something that works and suits them, suits their condition, suits their status, their access, all of these different things, so that we're really helping them find something that works for them. Okay, to say, I will leave you lots of different examples of things you could potentially signpost people to or hand out within your clinics or email if you're still not in the surgeries yet. So there are so many barriers that we hear on a daily basis. I spent 9 years working on the front line, delivering health interventions. I have possibly heard every barrier and every excuse to being more physically active than I care to remember. But these are some of the good days. These are some of the good ones. I just don't have time to exercise. I work a 12-hour shift. I haven't got enough energy to go out and do something else. Going to the gym is so boring. I hated PE at school and I still don't like it now. Why am I bothered? We've all heard these barriers, we've all seen them, we've all experienced them, but it's about how we take that, spin it on its head and start to have conversations with people around how we overcome some of those barriers. See, lack of time. Get them to monitor. Get them to do a diary. Monitor your activity for a week and identify somebody somewhere where you have got half an hour once a week. Half an hour. In your 7 days, tell me where you've got half an hour where you could go and do some form of exercise. And that comes back to finding that activity and that exercise that works for them within their own routine. Lack of motivation, lack of energy, plan ahead. Schedule it in. Is it that your physical activity that day that you're incredibly busy is actually that you're going to walk to work? Think about putting it on the to-do list, encouraging people to go to group classes, go with a friend. It helps motivate, it helps keep people accountable. Family obligations, my goodness. Johnny needs to go to this after school and I've got this and I've got 4 kids and I've got that and I've got that and I'm looking after my mum because she's not well. All of these different things is what can we do to overcome family obligations? Well, is it something we can do to encourage them to do it together? Is there something they can do as a family? Is there something they could do just at home? Kitchen discos, dance-offs between the kids and you, playing Nerf guns in the garden or around, think about things other than traditional exercise. It's just, again, encouraging people to move more. Lack of resources, lack of equipment, we hear that a lot. Select an activity that requires minimal facilities, minimal effort, minimal equipment. It doesn't cost you to go for a walk. It doesn't cost you. There are so many free activities that are out there and we can get signposting people to. And if it's something that you need help with, identifying free activities within your local patch, please do get in contact with me, and I will definitely see what I can do to help you with that and work with our active partnerships in these patches and see if we can identify stuff for you. Age. Fitness is just as important, if not more important, when you're older. So look upon your retirement as an opportunity to be more active. So encouraging these people who just suddenly stopped work or have been furloughed or have, suddenly have more time on their hands, think about what they can do. Again, integrating lots of different things, family, what they've enjoyed previously, keeping their social aspect. Tired, we all have really busy lives. Find a time when energy is at its highest, and increasing the amount of physical activity you do during the day actually increases your energy. So for me, if I don't get up and I don't go and take the dog out for work before I sit down at my desk each day, I struggle. I really, really struggle with concentration. I feel really sluggish and I drink far too much coffee if I don't get out. So I make it really important part of my day is that I get up and I take the dog out for half an hour before I sit down for the day. So when we're talking about being more active and utilising what we've got, we're not just talking about the clients that you guys are working with. This is about you too. We are looking to try and support you with your own health and well-being too. Okay. So if you've got a barrier, if you've got an excuse, I'll try and find something that we can get round to make it no longer a barrier. So long-term health conditions, barriers and considerations. With these guys, they're battling potentially 1, 2, 3, 4 long-term health conditions, trying to juggle it all and all of these different things. So things to consider and things to think about with them, and barriers that they probably will come up with for you as well. So pain before, during, after. I don't want that. It hurts too much. I don't want to do that anymore. I struggle enough as it is. Again, we're breaking it down. We're trying to be little and often. Feeling tired, feeling breathless before, during and after. These are all things that can be managed and monitored and encouraged. Fear of hurting themselves is a massive one. But there are groups, organisations, sessions, referral groups that are out there to support people with long-term health conditions who might be a little bit more complex, that need some help. And again, I can help identify those with you within your local area if it feels that that's something that you need, so we've got that nice pathway straight into there. Many people with long-term health conditions cite the barriers to being more active instead of seeing the benefits of being more active. It's really important when we're talking about these open conversations around, could I suggest something to you that I think might help you manage your diabetes, manage that knee pain, and see where the conversation goes for you. So the wider impact of being more physically active, we touched on it earlier. But if we can get our communities and our local and our clients more active, we see so much more than just the physical. We see benefits in mental, we see benefits in lots of different socio-economical determinants as well. So development of soft skills, impact on employment, it builds confidence. Being more active, it helps with social skills, it helps making and having conversations with people, which can help with self-esteem. Improved cognitive function, improved self-esteem, as we just spoke about. Enjoy it, a source of enjoyment and happiness. If it's something that they enjoy, being out in nature, going and meeting friends to go and play table tennis because they know they're going to get tea and cake as well at the same time, is brilliant because they see it as a highlight to their week. We talked about prevention of medical conditions already. Maintenance of strength, balance and motor skills is so important in every age range, every age group. Management of medical conditions too. So what's your place in all of this? Okay, we want to help you increase your knowledge around your individuals, communities, population needs in relation to physical activity. use the resources and the services available to you in the health and wellbeing system to help promote physical activity. To say we've got moving medicine, we've got the active practice, we've got really good stuff from moving healthcare professionals, active hospitals. There is a lot of content out there, and if you need help accessing any of it, then please let me know. Incorporating physical activity conversations and brief advice into routine care, into those routine follow-ups. Start the conversation. Hey, you know, have you been out and about this week? Have you been anywhere? Have you done anything? And start from there and seeing what you can do. We are looking to help provide high quality brief interventions for physical activity behaviour change. We're not expecting miracles overnight, guys. What we want to do is support you to help make those changes to people's behaviour to be more physically active over time. And you can do that by just helping, being knowledgeable around the important messages and understanding the benefits for everybody for moving more and being more active. So you play a really unique role in supporting people with at risk or developing long-term health conditions to be more physically active, as well as our generalised population as well. So you are really well placed to help us kind of on this future message. So one of the things we can do and how I can help you is across the whole of the East, we have got active partnerships. Active partnerships work collaboratively with local partners to create the conditions for an active nation. So these are the guys on the ground understanding what sessions might need to be commissioned, what opportunities might be out there. They can help groups and organisations get funding, be approachable, and be available to all. So we've got Active Norfolk, Suffolk, Essex, Heart Sports Partnership, Team Luton and Beds, and Living Sport as well. So lots of different people with a lot of information, and we can certainly help connect you into these teams as well. They know what's going on the ground. So if you're looking for a swim session in Deptford, these guys will be able to help signpost you. They have really good activity finders, so you can pull up their websites, pop in what you're looking for. Badminton session in Peterborough, for example, you can put that into their activity finder and it would bring up all of your different options as well.